Most hockey players use the frog stretch to open up their hips, but they're usually chasing the biggest stretch possible. So they slide their knees as wide as they can, pushing their hips back harder, and end up moving through their lower back instead of their hips. And if the spine is doing most of the movement, your hips aren't actually gaining hip mobility. If you want this stretch to actually help improve hip movement and skating mechanics, here's how to do the frog position the right way. The frog position puts our hips into an externally rotated position in an abducted position. This means the hip bone rotates outwards while the leg moves away from the center of your body. For hockey players, this matters because skating constantly requires the hips to control movement in this exact plane of motion. When you push off during a stride, your hips move into abduction and external rotation while producing force through the ice. So the real goal isn't to get a massive inner thigh stretch. It's to teach the hip bones to properly move inside the hip joint. And here's how to do the exercise. Start on the floor, being on your hands and knees. Slowly widen your legs apart until you feel a stretch in the inner thighs. Your shins should roughly be perpendicular to your thighs. Feet pointing outward slightly is okay. You're going to make sure you have 2 points of contact with each leg, having the inside knee being 1 and the front portion of the inside of the ankles is number 2. You don't need your entire ankle flat, just the front inner edge of the ankle touching the floor. Once you find those contacts, you're going to make sure you have your ribs stacking over your pelvis, keeping your spine neutral. Gently push your hands into the floor about a 1 out of 10 pressure, gently separating your shoulder blades from your spine. From here, gently shuffle your hips backwards. Think about a 3-second glide backwards. When you're gliding backwards, make sure that you have those 2 points of contact at all times. If the inside knee rolls off and the inner ankle loses contact, that's when you know you've gone too far. Once you find that mild and controlled stretch, take a slow inhale through your nose and expand your stomach for 2 to 3 seconds, and then exhaling through your mouth for 3 to 5 seconds as you get those ribs to descend down to your pelvis. Some common mistakes that we see in this exercise is as we're coming backwards into the stretch, people will roll into the middle portion of their knee and not the inside of their knee, losing the ankle contact just to afford a deeper stretch, arching your lower back to compensate for the lack of external rotation that we have, and in chase of the deepest stretch possible. Do about 5 repetitions of 20 to 30 second holds to ensure that you get the maximum external rotation and abduction within your hip socket.